this is approximately where we had left off with last time. Remember the four key concepts we wanted you to remember were the classifications of viruses and what is a retrovirus, provirus, and then whether it goes through the lytic cycle or lysogenic cycle. Okay, and again, we see that some of these viruses can compromise our white blood cells, and of course those are tied into or known as leukocytes that have an effect on our immune system. Okay. And again, the reason that we see, okay, in turn, affected individuals may appear normal. So this could be for a very long time, and this is where you have a person could be diagnosed with human immunodeficiency virus that leads to acquired immune disease or AIDS. Okay. And this is sometimes appears on the local news and national news. Chances are many of you, I would believe, probably had MMR boosters for measles, mumps, and rubella. And the reason that we give you those vaccines is it gives a boost to your immune system. Okay, very much like that of the flu shot, but sometimes that's just a guess on what we think that strain of virus might be for that typical year. So it's not all a guarantee, but it certainly is going to be more so of a benefit than not getting. Should you happen to come down with the flu, of course, even with a vaccination of the wrong strain, is still going to give you, I would believe, some benefits. They're going to be allow you to get better than not getting the flu shot. And as we see, a lot of this doesn't really appear to be a problem here in the Midwest because a lot of parents decide to have their children immunized. And polio has not ever been a problem for many years because we believe that has been eradicated or gotten rid of it. And this hepatitis A and B and chickenpox, a lot of people, even probably your parents, have been exposed to the chickenpox, so they will have a lifetime immunity to it. But in certain cases, a different strain they could be, let's say, exposed to, and then give secondary infection that is called shingles. And hepatitis A and B is just a type of disorder that then has an effect on the liver, and it's a type of inflammation of a virus that causes inflammation, again, within the liver. Okay, so I believe that does it for this chapter. And with the information behind this screen, again, it's a designation to hopefully try to get better at deciphering and reading graphs and interpreting information. So in this case, what we see behind this screen is some made up treatments for that of maybe different types of bacteria. Remember, if it's gram negative, it's pink in color. If it's gram positive, then it would be purple in color. And a lot of the gram positive bacteria are spherical in shape, and a lot of the bacteria that are gram negative are rod shaped. So the increase in numbers just gives you an idea of its effectiveness against whether it's gram positive or gram negative. So, for instance, just threw in like baking soda. It has a little bit of an effect with gram negative bacteria, but has no effect on gram positive bacteria. For instance, Coca-Cola, perhaps with the acidity or acid content in the cola, again, these were just thrown in to give you examples of what would be different types of antibiotics would be in the place where the treatment is. So Coca-Cola maybe does very well against gram-negative bacteria and has a little effect on gram-positive bacteria. And then just the opposite with carboxylic acid is, I believe, what I meant to write. Doesn't do much against gram-negative bacteria, but does a very good job against gram-positive bacteria. And then we see Advil does very well against gram-negative bacteria, but again, has no effect on gram-positive bacteria. So, for instance, if a patient was to come in and you're being the doctor, and you were trying to diagnose, to decipher, well, which type of bacteria they may have, because you really don't know. So your diagnosis is, well, we believe there's a bacterial infection. What would be the worst treatment to give? And again, that would be associated with lower numbers. And as we look at that, it would appear that baking soda would be the worst treatment for just having a guess on whether someone may be diagnosed with or trying to get a handle on gram-negative bacteria and gram-positive, because it has no effect on gram-positive bacteria, and it does all right with gram-negative, but should this be prescribed and the patient has a gram-positive bacteria, it's not going to have any effect. So in general, well then, it would appear that aspirin probably has the best balanced attack with that, because it has a 2 in each column, rather than having a 3 and a 0, or a 1 and a 3, or even having lower numbers like 2 and 0, like baking soda. It would appear that maybe aspirin would be the best course of action for trying to treat an unknown bacteria. Okay, so we'll try to proceed forward with reviewing again tomorrow, which of course is already Wednesday. We'll have an exam over these 2 chapters, 23 and 24, on Thursday. And weather permitting, we will continue to move forward with our lab series at some point next week. I've alerted administration to have bacteria cultures ordered, and my understanding they have been, so hopefully sometime later on this week, whether it's tomorrow or Thursday, these bacteria will show up so I can get them cultured and placed onto different growing media, and then at some point that will be your responsibility to transfer these bacteria, and then we'll begin our studies with that of doing the gram stain to actually try to get the correct results, because if we're looking at something that's spherical in shape, it should look all purple. If we pick something that's rod shaped, it should all be pink. We don't want to see any mix of the two, and that's how you're evaluated. If you have a gram-positive bacteria and there's some pink in there, that's not a perfect slide, but one that you would be graded on very well. Again, we don't want to see a mix of the 2 different types of colors, pink and purple, on these slides. Again, if it's gram-positive, we want all purple. If it's gram-negative, we want all pink. But we will discuss that at a later time.